Welcome back to the Nutrition Made Simple podcast, powered by Healthy Steps Nutrition. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach when working with clients. But we know that helping you become the best and healthiest versions of yourself isn't just about what you eat or going to the gym a few hours a week. We have to focus on a holistic approach, addressing nutrition, stress management, mindset, sleep, support system, and of course, lifestyle. My name is Nicole Aucoin. I'm the founder of Healthy Steps Nutrition and one of the dietitians here. In this podcast, we're going to teach you how to take one step at a time to becoming the healthiest version of yourself. I am so excited about today's podcast guest, Dr. Tom McCoy. He is an ER doctor turned into a functional medicine and private practice physician. He actually owns part of a CrossFit gym just meters away from his practice. He has a really unique story, but in this podcast, we talk a little bit more in depth about health and wellness and how the healthcare system is honestly completely broken. We talk about Whoop and different sleep trackers, what you should be looking for, and some things to help improve sleep. We also, of course, talk about CrossFit and strength training and why it is so important, especially as you age. Most healthcare professionals are stuck in this wheel of not preventative medicine, but more reactive. And Dr. Tom has flipped the script here and really focuses on preventative medicine. His story is really inspiring. He is doing amazing things in the CrossFit community. So excited for you to hear this podcast. Enjoy. We will get to this episode right after this message. Are you looking for a coach to help you kickstart your journey to health? Are you overwhelmed by all the different diets and different things out there to help you lose weight, get in shape, feel better? Well, at Healthy Steps Nutrition, we work with clients individually to help them where they're at, helping them create a realistic plan addressing nutrition, but also stress management, mindset, sleep, support system, and then most importantly, keeping you accountable. You can go to hireanutritioncoach.com to find a Healthy Steps nutrition coach near you. All right, let's get to this episode with Dr. Tom. Dr. Tom McCoy, welcome to the Nutrition Made Simple podcast. It is an honor to have you here with us today.
Nicole, what is going on? We're going to get into some stuff today. I'm excited to talk here.
Oh my gosh, we have so much to talk about. You are a wealth of knowledge. You are a advocate for CrossFit health and physicians and really bridging this gap between fitness and healthcare. We've had the opportunity to connect quite a few times this year, and it's been really fun to listen to you speak. I learn something every single time, and I just wanted you to come on and share your knowledge with others. Before we dive into all the good stuff, I think we need to preface this podcast with your story. You were an ER physician that flipped completely over to the preventative side. What caused you to do that?
Yeah, well, thanks for the opportunity to be here, Nicole. I'm really excited to speak with you and have the chance to talk one-on-one here after all our other activities. You know, I'll try to keep this as succinct as possible because I can certainly talk about this for an extended period. But, you know, from a training standpoint, you know, I'm actually boarded in family medicine and trained at a county program that was an unopposed residency. So was very fortunate because we had the opportunity to really do everything in the hospital, right? So delivered all the babies, did our C-sections, did surgeries, ran the ER, the ICU. So it was wonderful because it really gave you exposure to all these different aspects of medicine and really find what you were drawn to. And I was drawn to procedures and higher acuity. So after I finished training, started working in the emergency department right away and stayed at that hospital, for 15 years out in the Bay Area, and always worked at other institutions while I was there as well, just because I always felt it was important to expose yourself to different sites and hospitals as much to learn what not to do as what to do. And then I was director of the emergency department at the county hospital where I worked in the Bay for 8+ years, which was amazing. And I think, you know, to cut to, you know, the point of your question, our system is set up to be very reactive, and it essentially intervenes once disease and disability has really taken hold. And unfortunately, that's the way that it is incentivized to a major extent, and that billing codes and reimbursements are really geared towards, procedures and hospital stays and other things. And there are exceptions to the rule, but overall, that's how individuals make their money, right? And it's one of the reasons why so few people go into primary care preventative medicine, because the reimbursement is so low and school is so expensive. And in order to be able to make ends meet, literally, you have to cram an ungodly number of patients into a day, which directly undermines your ability to practice in a way where you can really educate and lead by example and spend the time developing relationships and explaining to folks how to really enact these lifestyle changes that can be preventative and not reactive, right? And being in the emergency department for that long, while it's rewarding and amazing and challenging, the being on the hamster wheel of putting Band-Aids over bullet holes and seeing the same problem each day while knowing that you aren't addressing root cause is something that eventually I think all of us have to reconcile with. And there's a component of moral injury as a practitioner that goes along with that. When you know that you can practice in a different way, and that given the right situation and time and scope, you could prevent this from happening in the first place. And hopefully that's the direction that we could all move towards, and ultimately got to the place to where I needed to, put my money where my mouth was and actually practice in a way that I felt good about every day.
And today, so from ER for many years, today you have a wellness practice literally connected to a CrossFit gym, which you are part owner in.
Yeah, that's correct. So I'm co-owner of an affiliate in Northeast Ohio and joined that ownership team about a year ago. My co-founder of our medical practice is owned and run that affiliate for what will be 9 years in this October. So longstanding, OG affiliate. And she's fantastic. And it's really been wonderful to step into a well-run affiliate and see how things are done. And then my practice is, about 100 yards away from my affiliate. So, I try to coach at least 2 times a week. And then, folks that I see in class then come over and see me as patients. And I always tell folks, I can yell at them while they're running their 400s as they go past the window. And this has really been the vision, for me for many years. And so to be able to see that realized is profoundly satisfying.
That's absolutely incredible. You mentioned a couple of things, talking about your history, this idea of moral injury, where something is broken, is wrong, but your hands are literally tied and you can't do much just with all the rules and regulations and the way the system is set up. The amount of times that I've heard that over and over again, and I personally felt it working as a dietitian in the hospital from every type of healthcare professional, it's common, more common than most people realize. What do you wish people knew about the conventional medical system?
Yeah, it's a great question. I think that, to your point, all of us have had the experience where we've gone to see a practitioner and we've been frustrated or upset with the lack of time or connection with the provider, or asking questions that the provider may not be educated around. I think the important thing for us all to remember is that the provider is just as, if not more, frustrated by the situation than we are as patients, and that we're all in the same boat. And that if there was an easy way to be able to do things the right way for the vast majority of practitioners, that's what they would do. And that setting up a practice design as we've been able to over the past number of years is not an easy endeavor. Otherwise, everyone would be doing it, right? And so I think all of us, both providers and patients alike, need to give each other a lot of grace here because we're operating in a dysfunctional system. And it's only really by working together and by us as patients showing what we value through our compensation and our time and our attention is then going to allow providers to design practices in a way that give individual patients what they need, right? Which is the ability to develop a connection, the ability to take an extensive and detailed history and exam when appropriate, and to be able to spend time with you to talk about how we are actually going to enact these lifestyle concept changes, right? Which is what our practice is founded on. And these are small, seemingly minor adjustments, right, to your daily behaviors that cumulatively over time yield huge dividends. But these are not things that can be conveyed or identified or surfaced in a 10-minute visit. And so all of us, by speaking with our attention and our pocketbooks, need to really, start to commit to a more sustainable model.
We often say your health is an investment, not an expense, right? Like it's so easy for us to go to a doctor and our numbers are trending in the wrong direction and a prescription is given when in reality, the root cause is the lifestyle behaviors, the lack of attention to nutrition, daily movement, sleep, mindset that ultimately we need to focus on in order to prevent the years of decisions that have caused us to be where we are in the first place. You and I have had the opportunity to speak at a few different CrossFit panels over the years. We did one this year in 2023 at the CrossFit Games on habits for health and performance. And there were a few things that you brought up that I was like, man, this is interesting and worth a more detailed discussion around. One was Whoop tracking and looking at strain and sleep and recovery. We find ourselves looking at sometimes the wrong numbers or putting too much emphasis on the wrong numbers. What should people be looking at if they're using one of these types of devices?
Yeah, no, this is I'll try not to get too high on my soapbox here. So you can see I have no wearables on at the moment. It's funny, when we go back to, when I started my CrossFit journey and when Whoop kind of first came into the space years later. And gosh, anybody that's been in CrossFit, most of us have probably had some experience with utilizing Whoop at some point or the other. And I remember thinking I was such a gangster because as an ER doc,
you're on your feet.
My strain score was like 19, 20 walking into class because I slept like 4 hours a night. I ate like crap. My allostatic load was out of control, and my autonomic nervous system was a hot mess, right? So the issue here is that, I tell this to folks all the time, access to information is not the issue now, right? All of us are inundated with data points coming from a multitude of different areas, and where, I feel like I can really bring value with, what my co-founder and I do is in the actual interpretation, right? The triaging of these data points, and then how you actually develop and enact a strategy to address what is most important, right? Because, I look back at it now and it's like, I went for years thinking that I was doing the right thing by pushing my strain score, not even thinking about recovery because I was like, recovery is for wussies, right? And I just had it completely upside down. And it wasn't until I got to the point in my training to where I hit a wall, right? Both from a body composition standpoint and from, an athletic achievement standpoint. And I started to realize, right, the connection between recovery, and recovery is a very broad term, right? But when we think about that, I'm talking about, your mindset, mindfulness, sleep, nutrition strategy, all these things play into your recovery and how impactful that is on what happens inside of the box, right? And so if I could wave my magic wand right now, in regards to wearables and in particular Whoop, it'd be to have a turn off the strain button. And if I could just get people to have the recovery score and put as much emphasis on it being in the green for recovery, as opposed to having strain contests, we'd probably be moving in a much healthier direction.
Let's talk a little bit about recovery. What causes recovery to be in the red or the yellow versus in even having, let's say I slept really good and I've got green in sleep, but my recovery is junk. Why would that be? What are some causes of poor recovery?
Yeah, I mean, it's a great question, Nicole. And there's the answer is it depends, right? I mean, even just to take your example, right? You can say, oh, my sleep is great, but it actually may not be. And just because you're spending 8 hours in bed does not mean that you're getting adequate quantity and quality of sleep, right? So, one area where this can be helpful, and wearables aren't perfect here when you're looking at sleep stages, and there can be a fair amount of variability in analyzing those based off of a wearable, in addition to your HRV, because different devices measure HRV in different ways, as opposed to, some will take averages over an extended period of time. Some will measure it during a short burst of time, first thing in the morning before you wake up to give you your HRV. And so there's a lot of variability that can play into that. And sleep is just one component, right? So, timing of your nutrition and being consistent with that, and the relationship with when you are trying to sleep can play a big impact on your recovery, right? And for all of us who have used wearables and tracked HRV, undoubtedly you've noticed that, if you eat a triple cheeseburger, 30 minutes before you go to bed, as opposed to having a 2-hour buffer in between when you stop liquid and solid calories, your HRV is going to respond very differently, right? And the same thing for alcohol. So it really isn't just about the actual sleep that you're getting, but it's about the quality of sleep, right? One of the first things that we talk about, when we're having this discussion with patients, is screening them for underlying diseases that can undermine sleep quality and quantity, right? And obstructive sleep apnea is, one of the first things that we talk about, right? So if you are predisposed to that because of body habitus, or if you've been told by your partner or know that you snore, have apneic episodes, you're swimming upriver if we aren't addressing that medically. And you can be in bed for 10 hours, right? If you're having 30, 40, 50 apneic episodes and waking up constantly and undermining deep and REM sleep, you're going to wake up feeling terrible, right? And so the devil's in the details when it comes to recovery. I think in general, how I think about wearables and how I utilize them these days is that they are a helpful tool, especially when you're modulating or incorporating new components of your health and performance strategy, right? So if we're adjusting timing of nutrition, or we're trying different training times or different supplement protocols, looking at your recovery score and your sleep cycles, even if the exact metrics aren't perfect, at least if you're using the same device, you're comparing apples to apples, and you can look for those trends to know if you're moving in the right or wrong direction, right? Where we have to be cautious is that for those of us who have OCD tendencies, and there's probably a lot of those folks listening, we need to be very cautious about not letting the wearable start to dictate our behavior, right? And there is a fine line between it being a beneficial purveyor of information and then being a slave to the data, right? And so once we're in a really good rhythm and we feel good about our routine and our training and our nutrition and our recovery, then take it off, right? Be in the flow state and be confident in what you're doing. And this especially is important when we're, working towards a competition, right? And we talk about this to our games athletes a lot. It's like the last thing that I want you to do is have a whoop on, right? Telling you that you got crappy sleep, before day 2. It's like, we know you're going to get crappy sleep like that. We don't need to know that, right? And there's good evidence that the impact of looking at that score can actually impact performance, right? And they've done studies where they give you, a sham recovery score, either positive or negative. And regardless of whether you had a restorative night's sleep or not, that is going to impact performance and how you perceive exertion. So the timing and how you utilize this information and having an appropriate balance and mindset around it, I think, is very important for all of us.
Super helpful. Thanks for sharing all of that. I know for me personally, I can look at my recovery score and know if I had anything to drink or not. Like my recovery will significantly decrease if I even have one glass of wine, which is important to know, right? Like what's more important, a glass of wine or having a good recovery? You mentioned HRV, heart rate variability. For people who've heard that term but don't really know what it means for themselves or their health, how would you explain heart rate variability?
Yeah, I think, the basic description is that it is a measure of essentially parasympathetic upregulation and autonomic balance and recovery. What it's doing is looking at beat to beat variability of your heart rate, right? And so the more recovered, right, and upregulated your parasympathetic side is, the more beat to beat variability you're going to have, and the higher your HRV is going to be. I think the thing for all of us to recognize is that we live, when you think about autonomic balance, right, it's sympathetic and parasympathetic sides of our nervous system. We live and operate mostly in a very sympathetically driven world, right? With work, with constant engagement, with social media, and what that does to dopamine and other neurotransmitters, with a lack of restorative sleep, with constant exposure to dysregulated forms of light, in particular blue light. All of these things are strain on our autonomic balance, right? And so I always like to have, especially with our elite athletes and everybody for the most part who we're working with in a comprehensive manner, an objective and a subjective measure of recovery. And I do track my sleep. It's integrated into my bed, so I don't have to have a wearable on, but that's really the only metric that I pay attention to and care about, is that I'm consistent with my sleep timing, and that my deep and my REM cycles are staying consistent over time, right? And that just lets me know that I'm on the right track. And then having a subjective metric, I think, is important too, right? And that can be as simple as, how are you feeling today? And if you combine that objective metric with one subjective metric, whatever it may be, that can really help guide you around intensity and where your focus needs to be on training or other activities during that day, right? And that can influence behaviors as you move into the evening. Like maybe tonight I won't have that glass of wine, or maybe I can really make an effort to get outside for 20 minutes during lunch just to sit in a park, right? And forest bathe and really leverage the upregulation of the parasympathetic side that happens when you're out of doors. And so those are ways that can be beneficial.
I love that. Thanks for explaining that. Um, Another thing that you mentioned in a CrossFit panel was this idea of 3-2-1. The 3-2-1 rule before sleeping. What is the 3-2-1 rule and why do you have it?
Yeah. So the 10-3-2-1 rule, I actually throw a 10 in there sometimes too. And this is not my rule. And I don't know where it came from or who came up with it. I've heard a number of different folks talk about it. So definitely don't credit me with this because it's not mine. But it is a great rule for lots of different reasons. And it is geared towards really optimizing autonomic balance and upregulation of the parasympathetic side and really your sleep cycle. So the numbers stand for hours in relation to when you're actually trying to go to sleep. Okay. So the 10 stands for caffeine, right? So 10 hours at least before you go to sleep, you really want to stop caffeine intake. Now, the thing to recognize with this is that we all have genetic variations or predispositions as far as caffeine metabolism is concerned. Okay. So our CYP2A SNP will help influence how quickly or slowly we're metabolizing caffeine. There's also an additional genetic variant which can exacerbate caffeine's influence at undermining the restorative nature of our sleep. So God forbid you happen to be a slow caffeine metabolizer and you have an increased sensitivity to caffeine disrupting your sleep, and you happen to be a 415 CrossFitter who likes to crush C4 before you go in, and you wonder why your recovery is crappy in the morning. You can see how all these things start to come together, right? So even if you're a fast metabolizer and you don't have that genetic predisposition, caffeine has a very long half-life. And so really trying to get at least a 10-hour window is important. So that's the 10. The 3 is in relation to alcohol. You can definitely extend that up to 4. But if you are going to have a cocktail or a glass of wine, I really try and encourage folks to do it, earlier in the evening if they can, either pre or with dinner. And a lot of us fall into the trap of we do dinner, we get the kids to bed, and then we have our glass of wine. And that is just a fireball of disaster on our recovery, which is the exact thing that we're trying to optimize, right? You really need to think about caffeine, as a sedative. It's almost like a benzo, right? It may knock you out, but it is undermining the architecture and the restorative nature of your sleep, right? So while you may think it's helping you fall asleep and de-stress, over the long term, it's actually making your problems worse. So if you are going to have a drink, 3 to 4 hours away from bedtime, you try and do it earlier in the evening. Okay. The two has to do with food. Okay. And we already alluded to this, but meals and caloric consumption, both liquid and solid. And remember, alcohol is a calorically dense liquid. And so that counts. But you want to have that spaced at least a couple hours away from bedtime. And another really important reason is there's a lot of us that struggle with gut permeability issues, whether it's irritable or inflammatory bowel or what have you. Allowing our digestive lining, the opportunity to heal and regenerate overnight is very important. And so getting that buffer is something that can really help both our recovery scores and our sleep optimization, but also the health of our gut, because those of us that train intensely, it's a real stressor. And then the one has to do with how we expose ourselves to light. And I could talk about this in and of itself for an hour. Light modulation and how we expose ourselves to it in the natural world for many of us is completely inverse to what we are biologically programmed to be exposed to. So how we modulate exposure to blue light as we move into the evenings and the specific devices that we do it through directly impacts melatonin secretion and the quality of the sleep that you get and sleep latency time, which is very important.
All right. So alcohol, 10 hours. No, sorry. Caffeine, 10 hours, alcohol, 3 hours, food, 2 hours, 1 hour light. So 10, 3, 2, 1.
And those are minimums, bare minimums.
Minimums. Okay.
It's a good rule of thumb to start getting folks pointed in the right direction.
And I would just, if you're listening to this and you've never connected the dots, just start paying attention to how you feel, how you sleep, how you feel in the morning. If you're not wearing a wearable device, if you feel rested or if you didn't, and just start connecting the dots between what you eat and how you feel, how you sleep, which is really fun. All right. I can't believe we've gone this long and we haven't really dove into CrossFit. You love CrossFit. You own a CrossFit. Why CrossFit? So many doctors, the perception is CrossFit is dangerous. Number one, how do you combat that? And number two, why do you love CrossFit so much?
Yeah, no, that's a great question. So for me, my vision and how I built my practice is that the affiliate is a health home. And when you talk about the foundational pillars of health, there is no better solution that I know of at this point in time that covers the most important bases than CrossFit. For me, when I'm first meeting with folks and when we're doing an initial survey of overall health, it's going to include an understanding of your nutrition strategy and what our goals are, your overall metabolic health, your cardiovascular fitness in regards to your VO2, what your strength and conditioning strategy encompasses, right? And there's usually 4 components that I think of there, and then recovery and balance, right? In the affiliate, when I'm coaching, when we can have whiteboard moments, all of those aspects are something that CrossFit has something positive to say about. The CrossFit nutrition strategy is a solid one and applicable to most of us to improve metabolic health, which is one of the main really health catastrophes of our time, driving so much chronic disease and morbidity and mortality. From a strength and conditioning standpoint, I think that all of us want to be hitting the pillars of moving heavy weight, of doing high intensity interval work, of balance and coordination. And then the one thing that we do need to work a little bit on incorporating into, especially depending on our resting metabolic rate and how well we utilize fats as fuel, is zone 2 work. And that's something, if you have mono days, that you can incorporate into once you understand what your zone 2 is. But CrossFit really does a great job of hitting, 3, if not 4 of those categories where a lot of other exercise modalities don't. I think as coaches, once we can understand the importance of how to leverage autonomic balance, and after you finish an intense WOD, how to teach people, ways and tools and tricks to move back and upregulate the parasympathetic side through breath work and mindfulness. You can take 2, 3, 4, 5 minutes after an intense WOD and talk to folks about box breathing or 4-7-8 breath work and how to kind of recenter themselves before you send them out into the world. These are opportunities to connect with folks and really strengthen the connection to your affiliate that they're not going to get in other training locations, right? So for me, if folks are willing, CrossFit is just a wonderful way to establish a very strong foundation upon which you can start to build all of these other health and performance strategies to really truly help you meet your goals. So it makes my job as a physician easier because it gives me a means by which to execute on all of these particularly important areas.
I love it. How do we combat the myth that CrossFit is dangerous?
Yeah, well, if you don't follow Dr. Amy West or you haven't listened to any of her lectures, I think she's a wonderful resource here. Amy has, done a lot of research in this area, looking into the actual studies that have highlighted CrossFit as being potentially dangerous. I think that, a lot of that information and that data and how it got shared was not true. And there was a lot of secondary gain by some of the individuals who published those studies. So I think it's always important to look at conflicts of interest of where the information is coming from and how it's being presented in the data set itself. That being said, another point that Amy makes, and I think is really important to highlight, is that it's also dangerous to sit on the couch. And that I would rather have, a twinged knee or a sore shoulder than have insulin resistance and a paucity of metabolically active tissue, i.e. muscle mass, and be robbing myself of the benefits from a cognitive standpoint that come with regular exercise. And so honestly, I think that you need to put the dangers and the risks in perspective and understand what you're exposing yourself to when you don't have a balanced exercise routine that's touching on all these core components.
I love that. Another question for you. As people age, sometimes they think, oh, I can't do strength training. But actually, as we age, to preserve muscle, we need to do strength training. Why is it so important as we think about menopause, postmenopause, females and guys, strength training? Why is that important? It's not just for the 20, 30-year-olds looking to compete.
Yeah, no, it's a great question. And yeah, certainly we could talk about that for an extended period of time as well. The big picture is that as much as we can, we want to build as much muscle mass at a younger age because it's easier because we can leverage our hormones to do so. From a female standpoint, as you move through the perimenopausal into the postmenopausal period, as your forms of estrogen change from estradiol to estrol and the influence that has on insulin resistance in your sleep, which can also drive insulin resistance and metabolic health, you need to think about that muscle mass as essentially being protective, right? To mitigate the impact of the change in your hormones that happens over time. And let's not forget about bone mineral density and mineral density and strength of your skeletal muscles, right? And that's also one of the reasons why CrossFit is so beneficial, because you have axial loading. And there's other ways to get this, right, through impact training and jumping, which I think are also very important. But one of the things that happens as well when our hormones, drop off a cliff as we move through that period is that we are set up for increased risk for osteopenia and osteoporosis, that regular strength training and axial loading will help mitigate it if we're doing it at the appropriate time. So it's not just about building continuously, but it's also about mitigating the rate of loss that happens inevitably to all of us once we reach a certain age. And if you've looked into the data and understand the morbidity and mortality associated with falls and hip fractures with, I think the last time I looked at this, approximately 30% of individuals are, dead within a year of a hip fracture. That should scare all of us. And every patient that I've ever worked with, one of the primary drivers is that they want to have self-determination, will remain in control of how they live their lives and not have physical disability limit what they want to do with their families or their friends or their hobbies, right? And so how we train and what we do now in our 20s, 30s, 40s, 50s is directly correlated to the quality of the health span and of the lifespan of how many years that we live going forward.
First of all, I didn't know that stat. That is insane. 30% of people will
Right, Nick. Yeah, I
die
have to double check that, but it's quite high.
Wow. Such a great explanation. Hopefully that gives people reassurance that, hey, as you get older, you can still do some strength training. It's actually really good for you. I love that.
Not can, it's
Should.
even more important. Absolutely.
I love it. Dr. Tom, you've been a big advocate for CrossFit Health since almost its inception. Why are you such a big advocate for CrossFit Health and bridging the gap between fitness and healthcare?
Yeah, I mean, for all the reasons that we alluded to, I think that if we are truly going to move to a proactive, preventative model of healthcare in the society, it's going to be through strategies that emphasize nutrition, strength and conditioning, and the importance of recovery. And for me personally, it wasn't in medical school, right, that I learned about these things and became educated around them. It was through CrossFit and being exposed to these different methodologies that really lit the spark for me to go, on my own educational journey that, a decade later has led to where I am, right? And I think understanding that and educating, other physician and healthcare practitioners who haven't gone through that experience yet, or maybe earlier in their training, and expose them to this paradigm so that they can think about how to incorporate emphasizing what's most important for a sound health span and lifespan strategy earlier on is what we want to do, which is one of the reasons why, I've always been so passionate about supporting CrossFit Health and in what's to come, right, in relationship of, medicine and CrossFit moving forward.
I love that. That brings me to my next question. What is next for you? I know at the CrossFit Games last year, you guys were talking about this medical society. What's coming up? Let us know.
Yeah. So, again, Dr. Amy West is taking the lead here with a number of us others, but we are looking to launch the CrossFit Medical Society here, hopefully within the next few months. We've gotten really supportive feedback from CrossFit HQ. And again, having been in the space long enough, I don't, count my CrossFit eggs before they're hatched, but I'm very hopeful that this is actually going to happen in the very near future. But the goal is for us to finally have a forum formally to where we can leverage best practices, support research, conduct outreach to individuals who are earlier on in their training to really educate and elevate the discussion around the CrossFit methodologies and how they can positively impact the health of our society and start to really connect with the individuals who most need it, right? And those are oftentimes the people who are most fearful about walking into a CrossFit box, because if any of us can remember back to the first time that we did it, I don't care who you are. If you weren't intimidated, I don't believe you. Intimidating,
so
right? And so, I think as practitioners, if we're going to be prescribing this, we need to be able to communicate to our patients in a way that makes sense and that is supportive. And know that we're partnered with affiliates in our community that are going to be welcoming and teach people how to train and progress in the right way, which is safe and systematic and incremental. And if we do that, the sky's the limit moving forward. I really think we can achieve whatever we set our minds to.
I love it. There are so many. CrossFit came out with a CrossFit Healthcare Professional Level 1. They're building this network of people, not just doctors, but also nurse practitioners, nurses, social workers, dietitians, you name it, that are believing that CrossFit is the way that can bridge the gap between fitness and optimal health. But I think sometimes we feel like we're on an island. And I remember back to pre-COVID days when Greg had the DDCs and we all got to come together. They were absolutely amazing. Karin mentioned that maybe they will come back. I'm hopeful for that. Not through CrossFit Health, but through something separate. I think that this medical society will really give an opportunity for healthcare professionals, doctors, and others to connect together so that we can not feel like we're on the island and support each other and fast track so that we can all rise the tide together. Where can people follow you and find out more information about the medical society?
Yeah, no, that's a great question. So on Instagram, I'm at Vital Human Doc, all one word. And then our practice is at McCoy-Medical. And so those are great ways to connect with us. And if folks have questions, they can DM us through those platforms and we can hopefully point them in the right direction. And then our practice website is McCoy-medical.com. And if folks want to stay in the loop about the medical society or other conferences or events coming up, because there is a lot of stuff going on, as you mentioned, Karin has been continuing to push to bring people together in this area. RevitaFest is coming up, which you were one of the speakers at. There's another conference in February coming. So there's a lot of really exciting things happening. Folks can email us through the website, and when CrossFit is ready, we can have that listserv ready to roll. We can get folks the information on how to join up with the medical society, so we can really start to speak with one voice and come together to start to really leverage all of our collective power. So those are probably the best ways to get in touch and stay connected.
Amazing. Dr. Tom, thank you so much for all that you do. Your passion is infectious. I am excited to continue to work with you in the future. And thanks for spending the last 45 minutes sharing all of your knowledge with us today.
Nicole, it's been awesome. I'm so glad we got the chance to connect here and look forward to the next time.
I hope you enjoyed that podcast episode with Dr. Tom. The big picture here is, in order to take control of your health, you have to be an advocate for yourself. You need to focus on the daily habits that are ultimately driving you to health and wellness and longevity instead of driving you closer to sickness. So, what are you going to do today? What's one step that you can take to take control of your health? Whether it be starting to go to bed a little bit earlier or following that 3-2-1 rule where you're trying to limit the alcohol that you have 3 hours before bed, food 2 hours before bed, light 1 hour before bed. Or maybe it's just prioritizing your sleep a little bit more. Maybe for you are doing a lot of cardio exercise, and after this episode, you're thinking, man, I need to start doing a little bit more strength training. Hire a coach and get someone to teach you good mechanics so that you don't hurt yourself. If you are looking for a coach to help you, you can go to hireanutritioncoach.com to find a Healthy Steps nutrition coach near you. The goal of Healthy Steps Nutrition is really to meet you where you are at, help you create a realistic plan to achieve what you are wanting, whatever that is, while addressing nutrition, stress management, sleep, mindset, support system, and daily movement. We focus on a habit-based approach, working on one thing at a time, and then your coach is going to keep you accountable. Communication is done through the Healthy Steps Nutrition app so that you have support between those in-person visits or those virtual calls. If you're looking for help, go to hireanutritioncoach.com to find a Healthy Steps Nutrition coach near you. All right, make sure that you subscribe. Don't forget to leave us a review if you enjoyed this episode, and we'll see you back here next week.